most of the people that we see, they are having trouble with sleep. They may be clenching their teeth. They may be grinding their teeth. They may be having trouble breathing. They may have jaw pain. They may have an uncomfortable bite. They may have a smile with crooked, crowded teeth that don't really fit well together. So what do all these things have in common? The one commonality with all these things is that they're all related to underdevelopment of the jaws and the face. When we're kids, our mouth and jaws and face are supposed to grow forward. They're supposed to get wider, and that creates more space for our teeth to fit together better, for our jaws to align better, for our teeth to be less crooked and more straight, more room for our tongue to fit in our mouth. Getting a little bit of forward growth gets our tongues to be a little bit more out of our throat. It allows us for our jaws to become like more upright, so we're not sitting back and down and jammed. All these things are related to lack of space and underdevelopment. Many of our patients have facial asymmetries and imbalances. For example, if I draw a line down the middle of my face, kind of a perpendicular to ground, and I draw a horizontal, my upper jaw should be parallel to the ground. My chin should be in the middle of my face. My eyes should be level with the landscape. My ears should be on the same level. Facial asymmetries and imbalances is an additional problem on top of the lack of space or the smallness that can be present in and about our facial spaces. Sometimes people will come in and the only thing that will be bothering them, and I'll ask them, I'll say, what is it that motivated you to come here today? How can I make you feel better? What is your goal? And people will say, well, doc, I sleep horribly at nighttime. I don't feel rested in the morning. I wake up with dark circles. I feel like I could just go back to sleep even after having slept for 10 hours. And then I'll say, do you have any jaw pain? Any neck tension? No, doc, I don't have that. So that patient will be treated much differently than the patient who says, doc, my jaw hurts and my neck hurts. And then I'll say, well, how do you feel when you wake up in the morning? Oh, I feel horrible, like I didn't sleep well at all. And those two cases will be treated much differently in the office. And it's very, very important to listen to these details. And that is going to translate into the type of different treatments we do for the patient. Corrective procedures are things that make a change. So if you're coming into our office and your mouth and face is underdeveloped, that is, your jaw should have grown a certain amount wider and a certain amount forward, we actually have orthodontic expanders and other types of appliances that will change the size and shape of your mouth. And if the teeth are in the wrong place in your mouth, we will move them around to actually correct your problem. In order to actually get you better, it's very important to understand the root cause of why you underdeveloped. And if you have these facial asymmetries, why are you asymmetric? If we don't correct the root cause of your problem, you will not truly get better and stay better. So let's talk a little bit about the root cause issues of why people don't develop enough and why they have asymmetries. When we're kids, there are different muscles in and around our face. And it's a well-established fact that pressure on bone as it's growing and developing affects its size and shape. So the tongue, for example, I like to refer to the tongue as a natural expander. When we're young and we're talking and we're eating and we're swallowing, The tongue is the only muscle in the mouth that pushes out. So that's how our tongue naturally expands our mouth. It literally sends a signal out to our bodies to grow outwards. Some of us will have conditions called tongue tie. That's a condition where the tongue is too tightly attached to the bottom jaw, and that limits the amount of pressure and the range of motion of the tongue. And normally we're able to see where people that have underdeveloped jaws and faces disproportionately have tongue ties. There are muscles on the outside part of our face and jaws that'll move around, and if they're too tightly attached, or quote unquote what we call tied, as our tongue and our face is trying to grow out, I guess our tongue is trying to grow our face out, if lips and cheek muscles are too tightly attached to our jaws and face, they can put a very strong retractive pressure. So during our assessments, what I'll do is I'll literally look in people's mouths to see if they have a lip tie, or if they have what we call buccal or cheek ties, or if they have a tongue tie. And if we see those things, we have special lasers, and we will treat and implant other oral tissue releases. If I go to put an expander in your mouth and I'm expecting to get growth, and these ties are pulling back and my appliances are pushing out, as you can see, these things aren't really going to work that well. Additionally, in our office, we use slow biological expansion. And that is heavily dependent on synergistically working with tongue pressure. So we like to get the tongue placed up on the palate so it's putting pressure in synergy with our appliances, and that's how we're going to get optimal results. So what about these facial asymmetries? How does that happen? Well, here's what I'll tell you. Not all attachments of muscles to our jaws have the equal amount of attachment. Sometimes when I go to do my patient assessments, I'll see that the cheek on the one side is tighter than the other. And that can like do this. And as our faces are growing, if the muscles are putting different pressure on one side of your face than the other, you'll get a facial asymmetry. So that's why it's very important when we're doing our assessments and we're going to start growing some bone. We want to release these ties and make sure they're not unevenly attached and make sure they're not restrictive. Additionally, we will design our appliances so as you're growing, the bite pressure will be level and it will act to correct the facial asymmetries. So as you can see, not all cases are created equal. It's important to understand that expanders in orthodontics are structural corrections. And just because you change the structure, for example, if I grow somebody's mouth wider, one of the reasons why we try to get the mouth to grow wider is to create more tongue space and create more space for the teeth to better fit. But I can tell you that just because I get somebody's mouth bigger and get their face to grow more forward does not mean that the tongue and all the muscles in and around the mouth are going to start functioning perfectly. So we will coordinate our structural corrections with myofunctional therapy. And what that does is it strengthens and trains and coordinates all the muscles in and around the mouth so that they work properly. Additionally, we will couple the myofunctional therapy with the release of necessary tethered oral tissues. That will actually allow the structure to grow more level and to grow outwards without interference. Additionally, once we get our structural changes, if the muscles in and around the mouth and the tethered oral tissues are released, things will actually stay in place. How disappointed would you be if we went through all these things to get your mouth to be a better size and shape and you still slept the night away with your tongue in your throat? you still clenched your teeth. And all that forward growth over a 10-year period retracted and collapsed. So that is exactly why it is very important to address the root cause issues of our patients' problems. We have many appliances for adults and kids. Some people need more width, some people need more forward growth, some people are asymmetric, some people are clenching their teeth, some people are not clenching their teeth. Some people are kids and some people are adults. So what we do at the TMJ Sleep and Breathe Center is we first listen to what your symptoms are and what your problems are. Then we do our assessment and we're able to correlate our findings in the assessment with your symptoms. We take a bunch of measurements. We take a look at what's not functioning properly in and around your mouth, and that dictates the treatment plan. We have many other videos that go into great detail about appliances for adults and kids and myofunctional therapy.